I want to talk about the general causes of HIV. The first thing is, this disease is sexually transmitted. For example, when you have sex with someone who is already infected, you can easily acquire the disease, especially when you've not used protective gadgets like condoms. Then the second cause, using sharp instruments that have been already used by someone who's already infected with the virus. For example, like safety pins, razor blades, you can easily acquire the virus. Then the third thing, you can easily acquire this disease, though it's some rare cause, through blood transfusion. Days back, blood was not properly screened. But nowadays, blood is safe. It passes through the right techniques before being given to someone. So that's why I'm saying it's a rare what? It's a rare cause. Then when it comes to pregnancy, the unborn baby can easily acquire the disease during labor, during breastfeeding, from the mother who's already infected with the what? With the virus. Then I want to talk about the signs and symptoms. How someone gets to know that I have the virus? First of all is through regular checkups. That is after 3 months, you're supposed to go and test to check how your status is. Then these signs, there are other signs that you can easily see. There are other signs you can easily see or have and start predicting that I may have the virus. First of all, there is fever, which is on and off. Then the second one is fatigue. Then the other one is rash, which may be localized in one place, or it may be just some generalized rash. Then another thing, sore throat, like when you're swallowing the saliva, some like persistent sore throat. Like whenever you swallow the saliva, you get that pain. Then I'm going to talk about the effects of HIV in pregnancy. First of all, the first thing, whenever a pregnant woman when a mother with HIV can easily get spontaneous abortions. Like whenever you conceive, the pregnancy gets out. Then another thing, you might carry the baby, let me say up something like 3 to 4 months. The same thing, the baby gets out. Then the other thing, giving birth to underweight babies, because we know that normal weight baby should be around 2.5 to 3.8. So when a mother has HIV, she's at a risk of giving birth to a low birth baby. Let me say something like 1.5, 1.8. Then there is what we call a premature rupture of the membranes. There is this fluid that protects the baby during pregnancy. So that fluid might rupture if a mother has HIV. Then there is what we call stillbirth. You might carry your pregnancy up to term, but then the baby dies immediately after birth. So I want to talk about the preventive measures. How can we prevent? Like how a mother can live safely with a baby without baby getting affected or without a baby dying. Then the first thing, as I've told you before, you should do regular checkups, that is antenatal care. Whenever they test you, for example, when your mother comes for antenatal and tests are done, they rule out that you have the disease, they will initiate you on treatment there and then. Then another thing, as I've told you, you're supposed to take the ARVs. Then another thing, how to prevent the baby from acquiring the disease, we should deliver from recognized health facilities. For example, in hospitals where there are qualified personnel like doctors, midwives, etc. Then another thing, remember, the born baby may acquire the disease through breastfeeding. So what we do, the mother does not breastfeed exclusively. The mother may breastfeed up something like 2 months and then starts the bottle feeding. And then another thing, good nutrition. Because whenever a mother takes a well-balanced diet, the immune system is boosted. Then finally, the mother is not at a risk of getting other infections. I think that's all.
Thank you so much.